Our next presentation is the FDA's National Retail Food Team Update. I'd like to introduce the Office of State Cooperative Programs FDA partners. First, Mary Cartagena, Team Lead of Retail Food Policy Team in the Center for Food Safety and Applied Nutrition. Then Tim Weigner, Director of the Division of Standards Implementation at the Office of Partnerships. And Janet Williams, Division Director, Office of Training, Education, and Development. I'll hand it over to you, Mary.
Okay, test check. I just want to know, can you hear me?
Yes, we can.
Okay, great. Well, hello, and it's a pleasure to be with you all today to talk about some of the cool stuff we have going on in the Center for Food Safety and Applied Nutrition, which I'm going to just call CFSAN from here on forward. Oh, next slide, please. So the nation's food chain is complex and multifaceted. There are three main levels, which encompasses production or farming, both domestic and imports, processing such as food plants and distribution centers, and food preparation from retail and homes. And the prevention systems need to be in place at every link of the chain, because a break in any one of those links of the chain can result in illness or death. Next slide, please. So within FDA, we have 3 federal state cooperative programs that specialize in milk, seafood, and retail food. These are large programs to administer, and FDA provides monitoring, oversight, guidelines, and training. In milk safety, it's over the grade A milk products, generally all the fluid milks. In shellfish sanitation, it covers mollusc and shellfish such as oysters, clams, and mussels. And for the retail food, there are more than 3,000 federal, state, local, and tribal agencies that have the primary responsibility to regulate the retail food and food service industries in the US. And they cover over 1 million food establishments, such as restaurants, grocery stores, vending machines, cafeterias, et cetera, et cetera. You all know the deal. And in these establishments, FDA has less formal leverage, but we have significant influence through training, consultation, and collaboration on state programs. Next slide, please. FDA derives its authority for providing assistance to state and local governments via the Public Health Services Act. And the goal of the National Food Safety Program is the reduction of foodborne illness. And to that end, FDA provides several pathways, such as development of model codes, working with our respective conferences on food safety issues, providing technical assistance, providing standardization to our regulatory partners, and initiating and overseeing retail-related research. And that link on the bottom, keep it in mind, because that link has a source to many, many FDA materials that is open to all of our stakeholders to have the wealth of information that we have. Next slide, please. Within FDA, we work in partnership throughout the agency in order to fulfill our mission in FDA with regard to food safety. The Center and the Office of Regulatory Affairs, or ORA, which you all probably know by, we work together towards reducing foodborne illness in retail food. And we are comprised of 4 different components. And as you can see on this slide, it's a circle. I'm part of the Center for Food Safety Applied Nutrition Retail Policy Team. We also work very closely with our ORA Office of State Cooperative Programs, ORA Office of Training and Education and Development, and ORA Office of Partnerships. So we all work very closely to move our mission together to work towards reducing foodborne illness. And but for the rest of this presentation, I'm going to focus on the initiatives of CFSAN, the top component on that wheel. Next slide, please. And so, as I had stated, I work for CFSAN within the Office of Food Safety, Retail Food Protection staff, and I lead the retail policy team. Next slide, please. And we have a mission to advance public health through the development of science-informed regulation, policy, and guidance for retail food safety and interstate conveyances. And we have a vision that provides national leadership on retail food safety policy, regulations, and guidance to agencies and organizations involved in ensuring the safety of food served to the consumer and the traveling public. Next slide, please. The two prevailing documents that provide the guidance and direction for the retail program are developed and maintained by the staff here in CFSAN, and those are the FDA Food Code and the Retail Program Standards. Next slide, please. And within our program, we have 3 areas of strategic focus, such as the policy development and interpretation, operational support, and education and outreach. And all of these strategic areas of focus comprise 9 program activities, with 6 of them key to our policy support. And as we move forward through the slides, I'm going to showcase several initiatives that have resulted from our work within our strategic areas. Next slide, please. So under the strategic area of policy development, we have worked within FDA's new era of smarter food safety. This may be a repeat for some of you, but you can't get through an FDA presentation without a mention of new era, which is really the blueprint that outlines a path forward that builds on the work that we have done and continue to do to implement the Food Safety Modernization Act, or FSMA. And the blueprint, which was literally shaped by thousands of stakeholders who provided input, represents a commitment that FDA makes to the American people to do all that we can, as fast as we can, as effectively as we can, to ensure that we have the safest food system in the world. And this is an agency-wide initiative, and we are so excited that retail has a large part in it. And as mentioned in previous presentations, there are 4 pillars to this blueprint, which is tech-enabled traceability, the smarter tools and approaches for prevention and outbreak response, new business models and retail modernization, and food safety culture. For the purposes of this presentation, I'm going to focus on core element 3, which is new business models and retail modernization. Next slide, please. Core element 3 is primarily focused in retail and ensuring the safety of food produced and delivered using new business models and modernizing traditional retail food approaches. Everybody owns retail. We experience it by getting our groceries, going out to eat, and getting food delivered. And this new era objective aligns with our agency's retail food strategic plan. And keep in mind that this is a 10-year plan and it's not going to happen overnight. And within this core element, we have 3 key areas of focus. One is on e-commerce, and it's really obtaining our stakeholder input regarding e-commerce in the United States and globally. The second area of focus is encouraging the use and development of smart kitchen technologies and equipment design. And it's really working with standard-setting stakeholders to facilitate the implementation of validated state-of-the-art technologies and equipment design. And the third focus area is to facilitate the safe development of new food ingredients and production technologies. Next slide, please. And as you've heard before, and we're going to keep promoting this as part of meeting our objectives within core element 3, FDA will be hosting a summit on October 19th to the 21st titled FDA New Era of Food Safety Summit on E-commerce, ensuring the safety of foods ordered online and delivered directly to consumers. This summit will convene industry, consumer experts, government officials, stakeholders, and all interested parties for a discussion and exchange of perspectives about the safety of human and animal foods produced, manufactured, sold, and delivered directly to consumers through e-commerce. We will be discussing topics such as the regulatory framework that applies to these foods and ways to strengthen food safety. So save the date, put it on your calendar, get on our website, the one that I had previously, so that you can register for this global event. Next slide, please. Within CFSAN, we work across the center with scientists to research some of the pressing questions for retail food safety. Over the years, some of our Conference for Food Protection, or CFP, issues have led to research questions that FDA has acted on with our scientists. And this research aids in informing policy development within the retail food policy analysis framework. At a glance, since 2017, we've published 12 articles or manuscripts, and most are available for free to download. On this slide, you can see we have the title of the journal on the left-hand side, the year it was published, and the title on the right. And some of our research areas include allergen transmission potentials, employee health issues, food safety management systems, risk factor occurrence, LM control in cut produce, and interventions in compliance, and many more topics. All of these help us inform policy decisions. And of note, this past year in 2021, we've recently published articles on hand washing observations and on date marking practices. So, go look at the journals and read the research, because it greatly informs and helps us move forward in food safety. Next slide, please. Now, as we transition to education and outreach, last year, we launched an interactive online training module titled Decoding the Food Code. It was designed to help our stakeholders better understand the structure, nomenclature, and conventions of the food code, such as explaining how the code is set up, how the chapter structure is and its function, describing the purpose of debitable and non-debitable provisions, summarizing how the words under and in are used to create cross-references, explaining what it means when we have a word italicized or in small caps. All of these different things are within the module of Decoding the Food Code, and all of this effort was made to strengthen our stakeholder knowledge of the practical science-based principles that we have laid out in the code. Next slide, please. Also on our Retail Food Protection website, we have a plethora of information and materials available for all of our stakeholders. So pictured here are several of the things that we have available. The first is the Employee Health and Personal Hygiene Handbook. This really brings Chapter 2 of the Food Code alive in an easier format to understand instead of codified text. It is available online for download, as well as in our resource center for ordering a hard copy. It's one of the most popular things that leaves the warehouse. So get your copy so that you could have one. You could order in bulk and pass it out to your establishments. We also have a whole lot of posters that really focus on food safety issues to help our food employees better understand their role in preventing foodborne illness. We have them in many different languages, and they're available for all of our stakeholders to download, and also, just like the Employee Health Handbook, available to have hard copies from the warehouse. One thing is that on this website, I just highlighted a few things, but on our website, we have a whole employee health section that has the posters plus videos. We have guidance documents. We have all information about the food code and our adoption maps and retail program standards information. So really, our website has a plethora of information. Make your way there to get it to assist you in anything that you need. Next slide, please. The retail program standards plays a huge role in our program. And I'd just like to cover a few initiatives that we have around the retail program standards. So currently, we are working with NACHO, or the National Association of County City Health Officials, on research topics surrounding the retail program standards under a cooperative agreement with CFSAN. And the most recent research is focusing on factors implementing timeliness of self-assessments and our verification audits by jurisdictions enrolled in the program standards. We're looking into factors such as length of enrollment in the program standards, participation in a mentorship program, flexible funding and usage of FDA resources, and online and on-site training workshops. And we want to use this information that we're going to gain from this research that's currently ongoing right now, so we don't have any details on it yet. But we're really looking at the research to explore ways to assist our enrolled jurisdictions in meeting self-assessment and our verification audit standards. We are also working on self-assessment and verification audit workshops, looking, at face-to-face and online developments. So just stay tuned and, keep in touch with your retail food specialists to, hear when these will be available. And for anyone that's working on the standards or wants to start working on them, may come to a point where you have some questions about an aspect of the standards and how it may apply to you or your jurisdiction. So the clearinghouse document is likely what you need. And it is a document that is full of question and answers and interpretations of each of the standards. And it is very useful for jurisdictions in trying to conform to the standards. It has been recently updated and is now available online for viewing and download. And lastly, I can't, have a retail program standards slide without talking about the retail flexible funding opportunities. As you know from Mary Beth's presentation, NEHA FDA is proud to announce the launch of the new retail flexible funding model grant program, which launched just a week ago. And this program will fund our state, local, tribal, territory regulatory programs as they advance in conformance to the standards. So I encourage each of you to go to NEHA's website, learn about the funding opportunities available to you as we work together to bend the foodborne illness curve. Next slide. So the next couple of slides, I'm going to cover some new FDA proposed rules that are coming to pipe. So back in 2004, Congress passed the Food Allergen Labeling and Consumer Protection Act, or what most people would know as FALCPA. And this law identified the 8 foods as major food allergens. They are milk, eggs, shellfish, tree nuts, peanuts, wheat, and soybean. And on April 23, 2021, the Food Allergy Safety Treatment, Education, and Research Act, or the FASTER Act, was signed into law, declaring sesame as the 9th major food allergen recognized by the United States. This change will become effective on January 1, 2023. So at the time of FALCPA's passing, the 8 major allergens accounted for 90% of the food allergies and serious allergic reactions in the US. And FALCPA requires that food or ingredients that contain a major food allergen be specifically labeled with the name of the allergen source. And Congress passed this law to make it easier for consumers who are allergic to food and their caregivers to identify and avoid the food that contain the major food allergen. And FDA enforces this provision of the law in most of the food packaged products. And so we will be working within the agency to ensure that all of our documents reflect this new law or this change by the implementation date on 2023. Next slide, please. The FDA is also proposing to establish additional traceability record-keeping requirements beyond what is already required in existing regulations for persons who manufacture, process, pack, or hold foods the agency has designated for inclusion on the food traceability list. The proposed rule, titled Requirements for Additional Traceability Records for Certain Foods, or more commonly known as the Food Traceability Proposed Rule, is a key component of FDA's new era of Smarter Food Safety Blueprint and will implement Section 204D of the Food Safety Modernization Act. The proposed requirements would help FDA rapidly and effectively identify recipients of those foods to prevent or mitigate foodborne illness outbreaks and address credible threats of serious adverse health consequences or death. So at the core of this proposal, it really is to help achieve end-to-end traceability from the source to the table throughout the food safety system, and tapping into new technologies and integrating data streams will help advance the widespread, consistent implementation of traceability systems across the food safety system. Next slide, please. In 2014, FDA issued a Federal Register notice to solicit comments on our draft approach for developing a list of high-risk foods. And taking into consideration the comments and other information submitted, we developed a draft risk ranking model and collected the data to populate the model for chemical and microbiological hazards associated with specific foods, with technical assistance from expert panels. We refined the model and updated the data and taking into consideration comments from peer reviews. And using the results of the risk ranking model, we tentatively have identified foods for the food traceability list, for which the additional traceability records will be required as shown on this slide. The term food traceability list refers not only to foods specifically listed, but also to any food that contains the listed foods as ingredients. And each proposed requirement pertains to all such foods unless an exemption applies. So again, the information on both the FASTRA Act and food traceability list are on the FDA website if you want more detailed information on that. I just wanted to present on these proposed rules as they will be touching and affecting our retail food safety system. Next slide. And this is just a reminder, if you liked hearing the initiatives that we're working on and want like up-to-date information for whenever we release anything, whether it be the food code, retail program standard updates, or any new informational guide, etc., please subscribe to our retail food protection page. This is our landing page where it's circled. You could click on that link to subscribe to our listserv, and anytime that we publish anything, whether it be a manuscript or whatever, you will get a notice. And that concludes my presentation. Thank you.
Thank you, Mary. I think we'll turn it over to Tim. And just a reminder, to learn more about the National Retail Food Team, you can visit the FDA team tabs on the Pathable website.
Yep, and good afternoon to everybody. This is Tim Weigner with the Office of Partnerships, coming from the think tank located in somewhere western part of Montgomery County, Maryland, or as my wife calls it, it's my office basement. Learn how to adjust because of COVID. And I want to thank you all for sticking with us for the rest of the day as we come to the closure. If we can go to the next slide. What you see on the screen right here is something that Priscilla just mentioned. This is a highlight of the 4 offices that are involved in the FDA National Retail Food Team, with the Office of Partnerships just as one. We all network together. We have a variety of the steering committees, the executive leadership advisory team. We have the national team itself, and we meet through all kinds of different things. But within the Office of Partnerships, we have 3 different divisions in our administrative staff. And the divisions include the one that I'm the director for, the Division of Standards Implementation. We have our divisions of integration, and then we have our Division of Partnership, Investment, and Agreements. And if those folks that know Barbara Cassins, she's been with the agency for a while. She's our office director, and she is very in tune to the cooperative programs because she started off her FDA career as a regional milk specialist. And she's a firm believer in what we do. And you'll see this octopus at the lower left-hand corner of the screen. Opie is our mascot for our entire office. And one of the staff came up and said, you know, we're so involved with different things that we have like tentacles in agreements and funding and partnerships and technical services on a wide variety of sources. So we decided to have this mascot, and that mascot gets passed around between all the divisions. Next slide, please. Just as with all the other offices within FDA, we do have a vision and mission statement. When you come back and you look at our mission statement, our job is really to make partnerships happen. And this can be through a variety of fostering funding agreements, such as you heard today from Mary Beth, fostering partnership agreements with states and local agencies to do a wide variety of inspections or leveraging resources, and also not just focusing on the domestic capabilities, but the international capabilities to support mutual reliance and systems recognition. And mutual reliance, I'll talk about that in a few minutes. Our vision, when you sit down and you really listen to everything from when Frank Giannis was talking first thing this morning with Steve Mandernack and Lori Farmer, and the recent presenters that we had from Washington State and Washoe County, what we're all trying to achieve as a vision is really to protect the public health. And I will tell you, as a parent whose son spent 3 weeks in a hospital because of a STEC illness and lost 30 pounds, I am truly committed to public health. And I recognize the people that it takes to get us there to make sure that we can do the right thing to protect public health. Next slide, please. And so you probably heard this term multiplier effect. We are a firm supporter of the multiplier effect because we recognize we cannot do this job by ourselves. You've heard a variety of presentations from states and locals. You heard the association representatives talk about the collaborative that we have with them. It's harnessing these capabilities and these capacities of these states, local, tribal, and territorial, in addition with associations, to really figure out how do we network. And it's just not one way FDA to our partners, it's to our partners with FDA and partners to partners. So what you see on the screen is just a variety of things that we do to help this multiplier effect, providing support for domestic inspections and sample collections. We have a large flexible funding model supporting laboratory capacity and capabilities involving 40 state labs at the moment. We work with our partners with OTED, and you're going to hear from Janet Williams here in a few minutes, and our other partners with IFPTI and a variety of training resources that we have at our hands. And we recognize it's the importance of having competent staff capable of doing the inspections and doing follow-up to prepare for, respond, and recover when we do have events. We also really put a lot of investment in the capabilities of our response mechanisms. I learned a long time ago when I was in the military, when I worked with the Food Marketing Institute, and then later working with a DHS consultant. Things begin at the local level, they escalate, they become multi-county, multi-state, national. And as they escalate up, we bring in more partners and leverage those resources. But when we get toward the end of de-escalating everything, it usually ends at the local level. So we want to make sure we leverage capacities and we recognize what those capacities are, and we provide that support to them, either in a technical support, such as through our retail food specialists, who are the face of the retail industry or the retail program within FDA, or through funding programs. You'll see in that middle right-hand side, the produce rule, and this is just one example. The Food Safety Modernization Act really changed a lot of what we focus on, focusing on risk, focusing on interventions. We provide a lot of funding toward programs to support the Food Safety Modernization Act, in addition with New Era and the retail program. And then the bottom right-hand quadrant is how do we share information and what vehicles are needed to share information, especially if it's sensitive and proprietary. And so you'll hear terms such as this individual's commission. They're acting on behalf of FDA. They have a commission or a badge that they reflect that they're acting as a servant of FDA or an agent FDA. And then we have our 2088 agreements that we're able to share information, such as those associated with investigations and foodborne outbreaks. Next slide, please. So how do we do this all? Again, partnership agreements is just one mechanism. The funding vehicle is another mechanism. On this slide is a pie showing different quadrants of where we provided funding. And this goes back to about FY20. And this really breaks it down. When you look at our lab capacity, we had about 4% that was funded to support our lab flexible funding model. The animal feed regulatory program standards was roughly 8% of our total budget. And then it just breaks it down. And you'll see produce is one of the large parts, and contracts. We rely on our state agencies to do a lot of work that the FDA recognizes the state has a capability, but it's also on location. And so we have states conducting contract work for manufactured foods and for animal feed, in addition with mammography type equipment. How good are we at where we are with the budget? Next slide, please. And this is really gonna showcase where we go and how successful we are. Back in FY14, our total budget was around $65 million. Where if you look at our budget at the close of FY20 going to FY21, it was about $126 million. This reflects a growth. And when you look at the bottom line on this chart, the blue line or the blue quadrant represents those contract inspections, and they stay fairly constant throughout the process. But when you look at the green area, that's where we see our grants and our cooperative agreements. And the luxury of the grants and cooperative agreements, as Mary Beth has said, and we heard in the previous presentation, they can occur multiple years, where usually a contract is a year by year by year service that we pay for. Cooperative agreement is allow you to do research. You can use the fundings for additional things, such as buying IT programs, providing for salary to support FTE work. And so we've seen this opportunity, and our model has gone from funding under contracts to funding under cooperative agreements and grants. But as mentioned in the very beginning and mentioned by a couple other speakers, with that comes a large responsibility for accountability. We have to be able to demonstrate to FDA senior management and also to our elected officials the success of these programs. This is where we rely on what you do if you're a grant recipient under like the retail flexible funding model, is to be able to demonstrate that success, be able to communicate those successes, because that helps us go up through the chain of command to communicate to those that allocate money to our agency. This is the reward that we're getting out of it. Here's the impact it has on public health. Please, please, please recognize the importance of that accountability. It comes with being a recipient of the grant program. Next slide, please. You all have heard a lot about program standards, and you're going to hear a couple more about program standards in the next couple of days. This slide is just a reflection of 3 of the known regulatory program standards. And this is where we also provide funding. And the funding is really to allow for the establishment of uniform and high quality programs from the state, local, territorial, and tribal level. For the voluntary national retail program standards, we recognize this is really the matriarch of all the standards. It was put in place to look at the infrastructure and the high quality program and how to work with jurisdictions to focus on the reduction of the foodborne illnesses. Whereas many of those within FDA talks about, and Frank Ioannis, I think, has coined this term, bending the curve so we can reduce the foodborne illnesses or the risk factors associated with those. So we have the voluntary retail program standards. The one in green is the animal feed regulatory program standards, where we have 23 states enrolled in this program under a cooperative agreement, working with our Association of American Feed Control Officials and our state counterparts. And then at the bottom, we have our manufactured food regulatory program standards. All these standards are very similar in outcome, and it's important to go back and look at that section 4 or that outcome statement of each individual standard, because you will see that there's similarities, but there's some nuances, and we have to respect those nuances. Nuances such as in standard 1 with the food code versus adopting or demonstrating equivalency with the regulatory foundation that FDA has. And standard 9, there's some little differences. But when you come back and look at standard 2 with training and having competent staff and basic level and continuing education, to standard 8 with resources, what resources do you have? They are all very similar. And again, the focus is on looking at, do you have a quality program that you can demonstrate what you have, what you may not have, and put in place an implementation plan that you can address those gaps. The other tool and luxury that comes from this, it allows you also sit back and say, when there are times where there's some reduction in resources, and we've seen that, or rediversion of priorities, where do you think you're going to take a hit? Where do you need to reduce those that support or prioritize? But how do you communicate the priorities of what you're going to be able to continue and what you may have to eliminate or put on pause? Next slide, please. So I want to kind of showcase one of the programs that we have available. And you'll see in the lower right-hand corner of this a map. This is our rapid response team programs, or known as RRTS. This is really a showcase of FDA's and what we're able to do. And the concept is very simple. It's a multi-agency, multi-team approach. When something happens, a disaster, an outbreak, it's bringing in all the right players that are appropriate and having them work collectively together. Again, come back on the concept. It starts local, it escalates up, and you may find out it's a multi-state program, so FDA would become involved, CDC would become involved, and now it's the networking that occurs, and then bringing that back down. The RT is such a great program. We ended up producing a video to showcase some recent events that occurred using Washington State, Wisconsin, and Maryland involving leafy greens. And again, it started off at the retail level. And the RRT program was able to demonstrate how this networking does occur. Their focus is on preparation, response, and recovery using this concept. If you happen to be in one of these RRT states, they're highlighted in blue. Dark blue are the funded states, light blue are the unfunded states, they're voluntary programs. It's not just for manufactured foods or animal feed. It's all the food related programs within that state, and that's what they manage. Next slide, please. So you may hear these terms about domestic mutual reliance. It's really, the term is to focus on what is a seamless partnership that we have from local, territorial, tribal, county, federal, and how do we work collectively together, and how do we demonstrate that we have comparable regulations or public health outcomes and be able to trust those resources that we have at the state and local level. If you visit the FDA.gov website, just use a search engine and type in domestic mutual reliance. It will take you right to the page. There's a long link at the bottom of this slide, but just type in domestic mutual reliance and you can see all the successes and showcase stories that we're able to demonstrate. As an example today, there was a signing of a partnership agreement with the California Department of Health to really leverage the capacity that they have on the manufactured food side and their laboratory side. And the California Department of Health happens to be one of those RRT states that have been involved with the leafy green outbreaks that we've seen here the past couple of years. So this domestic mutual reliance really allows us to communicate and showcase those success stories. So take time to visit that website. Next slide, please. And it's not just that we work with our local and our territorial and tribal partners. We work with a wide variety of associations, and you heard from several of them today. We also work with the 3 conferences, the Conference for Food Protection, the Interstate Shellfish Sanitation Conference, the National Conference of Interstate Milk Shipments. And these are the 3 cooperative programs that Mary Cartagena was referencing. But you'll see a variety of other associations on here, such as the National Conference for State Legislators, a great resource to tap in to figure out what laws are being pushed through the system at the state level. So this is just a snapshot of some of these associations. I do want to come back to one of the statements that Frank Janich mentioned in the very beginning of his presentation. He highlighted, working together, we can create a more modern and safer retail food safety system. If you grab that, you own it, and you put your passion behind this, it's not only creating a more modern and safer retail food safety system, it's bending the curve associated with foodborne outbreaks, and it's leveraging our resources and working collectively together. Next slide, please. As with everything that we do within the agency, if there's questions for more information, you can go to fda.gov, and there's a long link here that you can click on, but I always use the shortcut, fda.gov/regulatory partners, plural. And please visit the seminar portal under the FDA team, because it has linked to all these offices. And I will turn it back to you, Tracinda. Thank you, everybody.
Thank you, Tim. Welcome, Janet.
Thank you, thank you. And I think I'm the last person between your early start for dinner, so I'm going to try to make this quick and easy and talk about what's in it for you. Just like we usually run a relay race, they usually put the strongest runner at the end, so I'm going to bring it home for everyone. So my name is Janet Williams. I'm with the Office of Training, Education, and Development. I am the Division Director for the Division of Programmatic Training. OTED is responsible for providing training to all of our federal, state, local, tribal, territorial partners in every commodity that FDA regulates. We also work with universities, we work with academia, we work with industry, and our other center partners to provide that information. So we are the ones that try to provide you what you need to do your job the best you can. Next slide. We're going to talk about a number of things, and what I wanted to talk a little bit about was our registration process, our FY22 course offerings, and then give you some tips and tricks on how you can find some additional training out there. Next slide. The one thing that you should take away from here, on the previous slide, there was a website at the web list URL at the bottom. That is your key to OTED training courses. You need to have that, you need to keep that, you need to understand how to use that link, because it's going to get you into our Pathler systems where we're going to identify the courses. So our registration specifically for the retail components courses that we're working on opened up on September the 9th at 11 o'clock. We delayed that and did a hard launch on our registration process because we wanted to give more agencies greater access to the training, rather than have registrations come trickle in, 15 people on a registration list, 4 people on the registration list. We wanted you to have the time and the opportunity to really plan what your training needs were and how you were going to utilize that. We are working to have 3 participants per agency per course. That doesn't mean that you're only limited to 3. Please submit as many names and people that you need trained. We will populate a wait list, and we'll do 2 things with that wait list. As seats and slots become available for each course, we will contact those individuals on that wait list and put them into a course. And we also routinely take a look at that and assess whether we need to put additional courses based on the number of people that are waiting to get into a course, that there's a greater need that we may need to offer an additional training course or additional 2 courses. We offer our training courses free of charge to the regulatory community, and we partner with our national associations and our universities to deliver that. So we work a lot on the multiplier effect. We work with our partners to increase capacity, and we want to increase access. We hope that when you have your staff attend our courses, that you take that as an opportunity to set up a lunch and learn or a brown bag or an in-service seminar, that those folks come back to your organizations and provide training or provide information to your staff on what they've learned and the tips and tricks. That's how we're going to increase our capacity to make sure that we get this information available to everyone as best we can. Next slide. This is just an example of the broadcast message that went out announcing our registration process. If you didn't receive it, please reach out to your retail food specialist. They have a copy of it and they'd be more than happy to share. Next slide. So to get to the crux of the matter, here are the FY22 for the FDA. Our fiscal year starts October 1 to September 30th of 22. The courses that we're going to be offering that are going to be retail related. And while this is over 58 courses of the suite of courses and training courses that FDA is offering, it's really not all of the training that is out there and available to you. All of these courses are going to be delivered in a virtual format. We have increased the capacity in a number of our courses now that we figured out what we were doing since 2020, so that we can get more people in and we can do more work. We're also working on a pilot project, which we call independent course delivery. Again, is a process that we're going to be trying to utilize to provide a train-the-trainer course to provide to the agencies so that you can go back and train your staff. We are piloting that right now in 2 states, and we hope to release that information and that plan in 22. A lot of you probably remember it as a course in the box. That course in the box process sunsetted about 2.5 years ago. This is the new and improved process. And I think you'll find it, you'll have greater access, greater information, and more expanded capacity and capabilities out there. Next slide. But I also wanted to talk about other courses that were of interest. These are some of our online courses that are inside of our Pathler. Remember, I talked about that website address, that URL. These courses sit inside of that learning management system. There's a course on allergens. You no longer have to go to the UC Davis website to get there. There's a course on pasteurization, on plumbing, on smoking, curing, drying. Say you have a meat processor that's in your area that's making jerky and you need a little more information. You can go into the Pathler, put this number in there and come up with an online training course on how to take a look at smoking, curing, and drying, or fermentation. If you have someone that's making kimchi or sauerkraut, it's on-demand information that you can find valuable before you have to wait to get to a training course. It's learning on demand. Next slide. The other thing I wanted to show you is that how to use our system. I think that a lot of people think that they just find the retail courses and that's it, but there are a lot of ways that you can search for over the 200-300 training courses that we have populating this system. You can search by just all food, you can search by retail, you can search by categories, you can search by laboratory courses, administrative courses, cross-commodity courses, you can search by date range, you can search by keyword. And where you see that box that says category, that drop down has that and many other things. There are data courses in there, there are administrative courses. So there are plenty of trainings out there that would help fill the bill for your staff while you are training. And here's an example. When you put in, say, cross-commodity, which is one of the categories that you can choose, here's just a small example of what comes up with cross-commodity. Next slide, please. Take a look at that. You have courses in here on biological hazards, biosecurity, communication skills, food labeling, HACCP, FDA information sharing, sampling. This is just an example of the expansive nature of the online courses that are available to you. So while we are offering face-to-face or virtual courses, this plethora of information is also there and available to you that we are partnering with our partners in our academia and our universities and our associations to bring this information to you. Next slide. So I'm just going to stop. I think I made it 5:01. I'm going to say any questions because I gave you the what's in it for you, but if you have any information on the Passable website, I put a lot of job aids and a lot of information that kind of talks about what we just talked about so that you can use it. And we're always there available to answer any questions that you have. Reach out to your retail food specialist. They know where we live. And thank you very much for having us.
Oh, thank you, Janet. You are a rock star. I mean that. You have a lot of questions in chat. Questions like, how do I register? Am I able to get CEs for the courses? How can industry help out? Would you like to take a moment to answer some of these?
Yes.
Or is the best way just to do chat?
I can certainly answer.
Whatever you can do.
I can answer those in a couple of things. One of the job aids that we put out there on the Passable website is a job aid on how to register for a Pathlo account, how to print your training certificates, how to research and review your transcript. And every course that OTED puts together, we do offer continuing education unit, CEU. And for our industry partners, while you may not have access to the courses that sit inside of our Pathlo because they are designed for the regulatory, we have partnered with UL Engineering through a CRADA agreement, providing that some of that same training into the compliance wire. Industry is able to go into compliance wire and take those training courses as well. That is an agreement between yourself and UL Engineering. FDA just makes them available. So they may not be free to you, but they are accessible and they are available. Any other questions?
I think there's just a question on the website for those trainings. I believe that is on the FDA team page, but Janet, would you like to share that one more time as well?
I think it is, I always get it wrong. I think it's ORAU portal FDA or FDA/ORAU portal, but it's on one of the slides. I think it's on the second or third slide is the address.
Okay. Great. Thank you, Janet, so much. Excellent job. You have a lot of positive comments in the chat.
Can I answer this one question, Tracinda? One of the folks said, will the microbiology courses be added to Pathlo? Yes, we are currently working on that now. And we will also be moving the food code courses from Compliance Wire over there as well. So they will be living on 2 platforms. Okay, I'm done now.